I'm Alicia Jenkins. I'm an endocrinologist, a diabetes doctor and also a diabetes researcher. Here at the Baker, I lead the Diabetes and Vascular Medicine group, and as well as that, I'm also one of three leads on the diabetes program. So our overall goal is to help people with type 1 or type 2 diabetes live long and well. And what we want to do is to be able to predict as early as possible in their journey with their diabetes whether they're likely to develop complications or not, and which complications might that be: eyes, kidney, heart, nerve problems, and also to predict who will respond well to which type of treatment. The end result is not the publication or the conference presentation. The end result is that new knowledge that helps people live long and well out there in clinical practice. In Australia, about 10% of adults have type 2 diabetes, and there's over 100,000 people who have type 1 diabetes. Unlike earlier in my career, there's a big gap based on income. Or can you afford private health insurance? International research, including some of our own, has shown the benefits of using insulin pumps and continuous glucose monitors. This is the gold standard. Yet, only about 15% of Australians with type 1 diabetes use that technology, because in order to get an insulin pump, you have to have private health insurance. And particularly with the current cost of living, that is beyond the reach of many. Our research includes a lot of repurposing off-patent, low-cost drugs. That also makes our results very relevant to low and middle income countries. Also, even in affluent countries, not everyone can tolerate the newer drugs, say due to side effects, and not everyone can afford it. So by also looking at low-cost options and also building an advocacy to what we do, that helps make it relevant to other people around the world. Donors are absolutely critical to progressing research. There's various ways in which donors can help: by promoting awareness, by donating funding, just coming and visiting and sharing your story, becoming involved in the research so that you keep us on track to make sure that we are doing research that's relevant to you. And it's important that we have medical research, because if we just keep using the treatments of today, then we're not going to be able to continue to improve prognosis and health outcomes and quality of life.